The COVAX mechanism, as you are aware of, is one of that unprecedented effort made by WHO along with several other member states and organizations, including the European Union, which ensures this distribution or access to the vaccine to all countries, irrespective of their income level. The low-income countries, the lower middle income, the upper middle income, and the high-income countries coming together around that concept of ensuring everybody gets an access to this global public good. It's a matter that we should have that solidarity in our thoughts, in our actions, in reality, to ensure
we should have those in our thoughts and our
everybody
actions, but it's not happening. Wealthy countries are keeping the vaccines to themselves.
Yes, but we have seen that, and we are all seeing this, vaccine being rolled out in the high-income countries much faster than the other low-income and low-middle-income countries. But I think we have also seen the higher-income countries coming together, at least in the European Union, as you see, their commitment, and it's not only a commitment, but their contribution. More has to be done in this whole process, and there is no doubt into that one for sure.
What is the WHO's position on who should get it first inside a population?
At this point of time, the demand for the vaccine is not commensurate to the vaccine volume available. And hence, within the limited vaccine volume which is available to the country, there has to be some prioritization of the population groups. So the first category of the population group that should be targeted by the countries are health workers and social care workers who are at high risk or at very high risk of both acquiring and transmitting the infection. And then the second group are the elderly individuals which in the long-term care facilities or elsewhere who are having comorbidities, who are seen as at high risk of both acquiring the disease and also dying because of the severity of the diseases. This decision was made based on robust modeling done at both at the global level and also at the European regional level.
What about those who don't want to be vaccinated, the anti-vaccine movement? How much do you consider that movement a threat to global health?
I think if the population for whom this vaccine is destined to be used, if they're not using this vaccine, this will be a big loss.
Well, it'll be more than a big loss.
Contain.
It's a threat to health, isn't it?
Exactly. I think it's infectious diseases no borders, and I think if a population is not being protected, then there is always a chance of this disease harboring in the population and also moving into other parts. The ministries of health, that the government, including the partners and WHO, need to have very transparent communication campaign to the target population group so that they can understand the safety, efficacy, and the quality of vaccines. And if they have any issues around the vaccine, the healthcare professionals should be able, or they are equipped, to reply to those concerns and the questions that they have.
And what has the WHO learned about how to handle a pandemic or an epidemic?
Nobody can do this entire thing alone. There has to be inside the country a good inter-stakeholder, several stakeholders coming together because of the sheer scale of this implementation. And outside the country, there has to be inter-country collaboration around this entire context of vaccine access and also in terms of implementation. Other part which we have learned, preparedness is key. We cannot cherry pick one or two of the areas and say that we are ready. We have to be ready in this entire COVID-19 vaccination as one capsule of the immunization system performance in a country. Third part, I would say, is that any investment done in the COVID-19 vaccine deployment and vaccination should have a bearing in strengthening and having a resilient immunization system of tomorrow.
Dr. Siddhartha Datta of the World Health Organization Europe, many thanks for joining us on The Agenda.
Thank you. Pleasure talking to you.